Okay, looks like we're live, everybody. I'd like to call the November Health Committee meeting to order. Apologies, I'm dialing in from the thruway here, so just bear with me as we get through this. I'm not driving, just for the record. Can I get Rebecca, if we could actually take a roll call of the Health Committee members?
Or Mr. Chairman, Mr. Joyce,
Present.
Reedy,
Here.
Beston, Touche,
Here.
McLean Lane, Miller,
Present.
Tunney,
Present.
Ward, and Willingham.
Present.
6 present, Mr. Chairman.
Thank you, Rebecca. And what I'll do is, if any time my audio drops out here, maybe I'll have Mr. Reedy run the rest of the agenda. Is that okay with you, Mr. Reedy?
That's okay by me.
Here. So under previous business, can I get a motion to approve the previous meeting minutes?
Motion.
Second.
Second.
And a motion by Ms. Willingham and a second by, I'm sorry, I missed the second.
Mr. Miller.
Mr. Reed. Mr. Miller, okay, all in favor?
Aye.
Any
Aye.
opposed? Any opposed? Unanimous. Number 2 and 3 are being tabled at the request of sponsor, is that correct?
That is correct.
Okay, thank you, Rebecca. Moving under current business, or amending resolution number 370 for 2021 to accept additional grant funding regarding the COVID-19 vaccine response program. I saw Ms. Witherspoon on. Ms. Witherspoon, are you going to be speaking for the health department tonight?
I'm on as well. I don't know if you can see me.
Oh, I'm sorry, Dr. Mellon. You guys want to say a few words about this before we ask questions?
Sure. So, this is a request to accept additional funding of $539,000 for the COVID-19 vaccine response program for a grant total of $878,605,000.
Thank you, Dr. Whalen. Any questions from the committee?
Yes.
Go ahead, Pam.
Can you just give a brief overview of what the what that's about? What do you do?
So this money will be used to continue to conduct our COVID vaccination strategy, which includes education and outreach and pod planning and pod or vaccine clinic throughout the clinics throughout the county, throughout schools. And there is some of the money as well that is specifically targeted for vaccine uptake in racial and ethnic minority groups to increase accessibility for people with disabilities. So there's quite a lot that we're doing with this money. As you know, we have shifted our focus now to doing boosters and to doing the pediatric vaccinations for the 5 to 11. We're also making sure that boosters can be given to the, OPWDD and other at needs communities.
Can I ask you what kind of information have we gotten out about people who may have come through all of the clinics you did, let's say down at the what M&T Bank or whatever it's called now? Did we keep up with the people that came through down there? And is there any contact for them about boosters?
So, in terms of keeping contact with people, when they get their vaccination, they would be entered into this state system to record that they had vaccinations. We have definitely done a lot of work on messaging that if you are eligible for the vaccine booster and you have been more than 6 months since your first dose, it is eligible for you and it is widely available.
So did you give cards to all of the people who got their second shot? What was the percentage of the people you gave the initial shot to that you were able to provide the second shot to? And then also, how were they able to attain their card?
So I don't have up-to-date statistics on that. I could go back and check, but I know at a couple of instances, we looked at our rate for people that got first and second doses, and it was significantly higher than 90%. So some other counties had problems with people not coming back for their second vaccines, but overall we did pretty well. And everybody that came got a card with the dates on it. They were also encouraged to sign up for the New York State Excelsior Pass, which contains information on when you got your last dose in the pass itself. An Excelsior Pass Plus contains both dates when you got your vaccine. So people should be aware of when they've had them.
So can you tell me what Albany County's numbers were as far as you are concerned? How many shots did we do?
How many shots did we do? Over 42,000. And with the shots that we managed, it was over 70,000. That's the last number that I looked at. That's an approximation.
Okay, have we done any Johnson & Johnson or no?
We have.
Oh, we have.
Yep. We
Okay.
have.
Okay, are we doing home visits at all?
We are.
Okay,
Yeah,
and
we work with the Department of Aging, who collects information for homebound people and then arrange to have people go out and provide vaccination.
okay, and so you're also talking about as far as minorities are concerned. Now, did we keep track of any demographics as far as, you know, race was concerned on who received those shots?
Yes, we did. I don't have that right with me, but I can certainly get that to you. Are you looking specifically for vaccines from our clinics that we provided, or are you looking for vaccines within Albany County as you know, a numerator denominator?
Well, I guess I could say I'm interested in both, but I know that you had a real campaign going on down there. And so I feel a little bit safer trying to figure out what we did. And so, and then that would give me an idea of how many people outside of the county were providing shots. I do know that, let me ask you this, would Sheriff's Department be included in your numbers or no?
Not in our numbers, no. They are completely independent from us.
Okay, so in the beginning, when they were passing out the shots and the vaccine, I'm sorry, we were limited. You were limited as to who could get it early on years. Is that right?
Yes,
Okay,
we
but
had
it's
to
not-
follow the criteria for that was established by the CDC and the New York State Department of Health.
But that's not happening now, is it? The way it was in the beginning?
No, it's not. The criteria has been significantly expanded. And I think, the governor did mention the other day that she feels everybody over the age of 18 who is looking to get a booster should get a booster. We haven't had that in writing from the New York State Department of Health yet, but I know that is a conversation. We're not turning people away.
Can you tell me how well you've been able to do in the minority areas, in African-American areas? Because you did mention that,
Yeah. So, we have, first of all, I'd like to thank you for your help because you've been very helpful throughout this entire effort, as have many others. I think that we have community health workers. We are looking for community partners. We are looking for, organizations, including churches where we can go and do vaccines. So we've really tried to embrace as many innovations to meet people where they live. We worked with the Housing Authority. We have worked with neighborhood associations. And we're always, looking for additional suggestions that people have to do this. There's the education piece, and then there's the vaccination piece. The education piece is, sometimes a little bit more challenging, but we do have a number of community health workers that are out, again, promoting this vaccine, particularly where we know, we have higher numbers of people of color. And I think, overall, people have been very forthcoming with their questions and concerns. We are ready to assist with answers, and, we continue with that mission. I think there are still people out there that are not vaccinated that are eligible to be vaccinated. And while I can still say that, we will continue to work on this.
Are we, are we just limited to Albany County residents, or will we take anyone?
We don't turn people away if they come from another county.
All right. All right, thank you so much, Dr.
Thank
Whalen.
you.
Doing a fantastic job. I just want to say that. Thank you so much.
Thank you.
Thanks, Pam. Any other questions from the committee on number 4?
If there's no other questions, I'd just like to make a motion.
I'll note your motion. Dr. Whalen, I just did have one question. So I follow the press release. I see, there's percentages of how many have received both doses. Percentages on how many of our residents received the booster.
I don't have a percentage on that yet.
Yeah, no,
So
I'm
that
just,
would,
it's as they, over time it wanes. So you want to make sure that people that receive the booster kind of meets that metric of the people that have had both doses, right?
yes.
Yeah. Okay, I'm sorry. We do have a motion from Ms. Willingham. Any other questions before we look for a second?
Second.
Hearing none. Do I have a second there from Mr. Touche?
Second.
Okay. All in favor?
Aye.
Aye.
Any opposed? Excuse me. Number 5, amending the 2021 Department of Health budget, public health technician.
Okay, hopefully this is straightforward. It is just permission to amend the 2021 budget to increase a public health technician line by $341 due to a collective bargaining salary step.
Thank you, Dr. Whalen. Any committee?
I'll make the motion.
Second.
I'll second.
Okay, I heard motion made by Mr. Ward, second by Mr. Reedy. All in favor?
Aye.
Aye.
Any opposed? Unanimous. Number 6, amending the 2021 Health Department budget overtime line.
Yep. So again, this is a request to fund our per diem and overtime lines to account for increased case investigation and ongoing community vaccination efforts. So a portion of this money is to support staff that are working overtime, and a portion is to pay per diem staff that have come in to assist with vaccination clinics and contact tracing.
Thank you, Dr. Whalen. Any questions from the committee?
No,
Make a motion.
Hearing
I'll make the motion.
motion made by Mark, can I get a second?
Second.
Second by Mr. All in favor?
Aye.
Aye.
Any opposed? Unanimous. Thank you, Dr.
Thank you
Wanna,
very much.
I think we move on to mental health now. Dr. Giordano, are you on tonight?
Yes, sir. Good evening.
Good evening. How are you tonight?
Very good. Thank you.
Number 7, authorizing with information management regarding patient and billing software at the Department of Mental Health.
Yes, Mr. Chair, this is a contract renewal request with Information Management Associates. They've been a long time partner with us. We have a state-of-the-art electronic health record that also is a billing software program. The 2022 contract is in the amount of $104,904. And we're very satisfied with this tool. We have an archive of probably almost 25 to 30 years of patient records, which is very important given the fact that many of the folks we serve for a very long time. So we'd like to request permission to enter into a contract renewal.
Thank you, Dr. Giordano. Any questions? Hearing none, could I get a motion to move?
Motion to move.
I'll make.
I'll make a motion.
Motion made by Mr. Reedy. All in favor?
Aye.
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 Any opposed? Unanimous. Number 8, authorizing an interdepartmental agreement regarding single point of access services.
Yes, thank you very much. As you know, I come before you each year with a host of OMH state aid funding pass-through contracts. This is one of those, but it's with one of our partner agencies. This is 100% state funding with 0 county share. It's for the Department of Children, Youth, and Families, and it is for their mental health clinic and health home and single point of access services in the amount of $308,007.
Can I
Any
just ask,
questions? Go ahead, Ms. Willingham.
okay, can you explain the program just a little bit, Dr. Giordano? You said it was for children?
Yes, excuse me. As you know, many years ago, the mental health services for children in Albany County was split from the Department of Mental Health and put into the Department for Children, Youth, and Families. They receive some state aid support, as do many of our local mental health agencies each year. They run a clinic. They have for youth here on our health and mental health campus. They have a health home for youth, and they also serve as a single point of access to help the most needy people get to the services that are available. So they are certainly one of our biggest partners in the mental health service area. They focus on those below the age of 18. The Department of Mental Health focuses on 18 and above.
Can you tell us what the numbers are?
I can certainly get them for you, but I don't have them. The numbers of people served, or?
Yes.
Yeah,
Yes.
I would have to get that from Commissioner Manning. She runs the program on a daily basis, but we'd be glad to provide that for you.
Thank you.
Sure.
Any other questions from the committee? Hearing none, can we get a motion to move?
Motion.
Motion by Ms.
Second.
Willingham. Do we have a
Second.
second by Mr. Ward? All in favor?
Aye.
Aye.
Any opposed? Unanimous. Number 9, authorizing an agreement with the Psychiatric Group of Albany regarding psychiatric services.
Mr. Chairman, the Department of Mental Health is requesting that this item be tabled.
Okay. We'll table number 9. We don't need to vote on that, right, council, because it's tabled by the department, correct? Correct. Okay, thank you. Number 10, amending the 2021 Department of Mental Health budget overtime line.
Yeah, thank you. This is a request, as you say, to amend the overtime line. We're requesting to take $20,000 from a vacant position and move it into our overtime line for our mobile crisis team and our jail mental health unit. Over the year, you've heard me talk about the increased demands on our services across the board, but there are 2 programs that we run that we can't shut the spigot off, and we can't reduce the amount of services we're providing as we can, for example, in our clinic. But our mobile crisis team is 24/7. They've got to be on the road, and our jail mental health clinic operates in the sheriff's correctional facility, and we have to respond to the need as it arises. We have had a significant shortage and difficulty in our clinical staffing. We're aggressively trying to fill those positions, but that's resulted in an increase in overtime in the last couple of months, and we project we'll need 20,000 to get us to the end of the year.
Okay. Thank you, Dr. Giordano.
Can you see me?
Hearing none.
Can you see me?
Go ahead.
Okay, so are we talking about services exclusively at the jail right now, Dr. Giordano?
Well, our mobile crisis team is countywide. We're 24/7, and we've just got to make sure each shift is filled. The correctional facility, though, as you say, we have a mental health unit there, and part of this is for overtime there. We need to move people from other parts of our department to fill shifts in both of those programs.
So there isn't just someone assigned to the jail?
Oh, there is, but we have vacancies that we can't fill.
How many people assigned at the jail?
Well, we have about 7 social workers and 40 hours a week of psychiatry, but we have 3 vacancies right now at the jail. Our mobile crisis team with Accord has about 9 or 10 social workers, and we have 2 critical vacancies on the overnight shifts, which we, as I say, we have to just move people or ask them to work extra hours to fill those shifts. we can't not go out on the road for our emergency programs, and we can't not fill our jail positions.
Okay, just bear with me.
Sure.
Do we have people that are assigned, how many people are assigned at the jail? And working now, full-time?
Okay, well, we have 7 social workers assigned to the jail. 3 of those positions are vacant right now. So we only have 4 people there. We also have 40 hours of psychiatry and nursing that we provide there. So it's a very busy, full operation, full-time, 7 days a week.
So when you say nursing, you
Nurse practitioners in the psychiatry group,
okay.
they provide, they act just like psychiatrists. They can prescribe medication, they can give injections, and they're part of our mental health clinic.
Thank you.
Oh, you're welcome.
Any other questions from the committee? Hearing none, can we get a motion to approve number 10?
Motion to approve.
Second.
Motion
Second.
by Mr. Ward, all in favor?
Aye.
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 Any opposed? Unanimous. I do want to back up to number 9. Apparently, we do need a motion from the committee to table this. It was tabled on the request of Dr. Giordano, so can we get a motion to table number 9?
I'll make a motion.
I'll second.
Motion made by Mr. Beck, I think the second by Mr. Touche, all in favor?
Aye.
Aye.
Any opposed? Unanimous. Does that resolve the issue, council?
Thank you.
Okay, thank you. Number 11, authorizing an agreement with the New York State Office of Addiction Services and Supports regarding workforce development funding. Dr. Giordano.
Yes, thank you very much. So the OASIS has received, as part of a federal block grant, money that at the state level they're distributing to all counties across the state. This is a formula-based allocation. It's based on the services that we provide to addicted populations, which is a part of our, a smaller part of our overall operation. They've decided that the formula leads them to give us $8,500 for workforce development. There are some rather stringent parameters around how this money can be used. There are challenges with regard to distributing the money fairly, and we've talked with our unions. We've decided to put this money into our training budget, which will allow for the use of additional training in a spirit of workforce development for the year 2022. So we're requesting to be able to accept $8,500 and to place it in our training budget.
Any questions? Hearing none, can we get a motion to approve?
Motion.
Motion made by
Second.
Mr. Second by Mr. Ward. Favor?
Aye.
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 Any opposed? Unanimous. 12, authorizing an agreement with the New York State Office of Addiction Services and Supports regarding workforce enhancement funding.
Yes, Mr. Chairman, that was listed in error. That should be the Office of Mental Health. So this is a companion to the one we just talked about, but the number 12 is for the Office of Mental Health.
Okay.
Shall I proceed?
Sure. Yeah, go ahead, Dr. Giordano.
So in a similar vein, the federal block grant for community mental health services, the federal money that comes to the state Office of Mental Health has deemed that a certain amount of money statewide was going to be available for workforce development. Again, it's non-competitive, it's formula-based, and since our mental health services are bigger than our addiction services, this award is larger. They're offering us up to $100,000. We have to accept it rather quickly before the end of the year. The parameters are a little bit broader. We're in the process of trying to decide how best to distribute or to use that money in the spirit that has been given to us. But again, we have to make sure that we are doing it fairly and working with our unions. So all we're asking for today is to be able to accept the money up to $100,000. And we don't have a real formal plan yet on how to distribute it, but we will.
Thank you. Any questions from the committee? Hearing none, can we get a motion to move?
Motion to move.
Motion made by, have a second by, I think that was Mr. Best, and all in favor?
Aye.
Aye.
Any opposed? Unanimous. I don't think, Mayor's office, we're gonna get this number 12 reworded before the county meeting, just so it meant Office of Mental Health.
Yes, that will be fixed.
All right, thanks.
Thank you.
That's it. Thank you, Dr. Giordano.
Yes, sir. Thank you to you and to the committee. Be well.
Thank you.
We get a motion to adjourn.
Motion.
Motion.
I make a motion.
Motion by Ms. Willingham, second by Mr. Best, and all in favor.
Aye.
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 Aye.